Hello, everyone. Welcome to the Dr.Sophia ObGyn Podcast. I'm an ObGyn practicing for over 15 years in my native New York City, and I love to help women learn about their bodies, empower them, and embrace themselves. On this podcast, we talk openly and with heart about all things affecting women, from pregnancy, menopause, periods, sexual health, fertility, and so much more. Disclaimer: this is general medical information based on my professional opinion and experience. For specific medical advice, please refer to your physician. Hello, everyone. It's me, Dr. Sophia, and I'm so glad to have you back with us as we talk about a very important subject called STDs.
Also known as
STIs.
Which means
sexually transmitted diseases and sexually transmitted infections. So we'll be using those two terms kind of interchangeably to mean basically the same thing. I had a patient that made this topic come to light. And so, as always, I am joined by my good friend and co-host, Touseef Mirza, while we dig in.
Let's dig in. Hi, everybody. So yes, the reason why we wanted to talk about this is obviously STDs is a big subject, right? And we were going to eventually talk about this because it's an important subject in sexual health. But that being said, Sophia talked to me about this patient she had, and we said, you know what, let's just really talk about a patient's journey in terms of different things that happen to them from an STD standpoint. So we're going to start with the story and then really sort of connect all different aspects of STDs from there. So Dr. Sophia, can you tell us a little bit about the patient that you mentioned to me?
So every single day I treat, test, discuss with patients things about sexually transmitted diseases and infections. But I had a long-term patient of mine who came to me. She is a woman of a certain age, so I'll say she's in her 40s. And she's been my patient, like I said, for a long time. And she kind of came to me a little distressed. She'd been in a relationship for about 4 years, and she was super happy.
A monogamous relationship.
And she came to find out that her partner, boyfriend, significant other was cheating on her.
Oh, boy.
And not only was he cheating on her, he was cheating on her with multiple women. And so she came kind of a nervous wreck, to be honest, with, "Doctor, I need to make sure I haven't contracted anything. Please, can I get testing?" And I said to her, "Of course." And I asked her, I said, "Well, are you having any symptoms, signs, anything that would make you feel like you have contracted anything?"
So when we say contracted, it means that you have received or that you've been...
That a sexually transmitted infection was transmitted to you.
Mm-hmm. Okay. Since he was with other women, the probability of that obviously increases.
That is correct. Multiple partners increases your risk of sexually transmitted infections. And in her case, she was unaware, that he had multiple partners. And so because she thought she was in a monogamous relationship, they were having unprotected sex or sex without a condom. And rightfully so, she came to me very concerned. She came to me extremely ashamed. And actually, that's a real big part of why I wanted to do this podcast, because yes, she was angry at the fact that this guy could do that to her, but moreover, she felt ashamed, embarrassed, frustrated with herself that somehow she let this happen, right? But the concept is she didn't let anything happen. She thought she was in this wonderful relationship. And it's a reminder that we only know what we know, and we can only control what we can control.
I mean, number one, the fact that she didn't even do anything wrong, right? The
Right.
guy is the one who's fooling around and did not say anything to her.
That's correct.
And now we have the woman feeling bad. Meanwhile, she hasn't done anything wrong.
Right.
She's going with the trust that she has built
Exactly.
with the man. So it's kind of crazy, like what we do to ourselves as women. It's like we're not even the person that did the wrong thing,
But we
we're
are
the
very
ones.
quick always
Yes.
to blame ourselves,
Exactly.
to feel guilty, to be embarrassed. And yet, in this particular situation, she honestly was going on faith and the trust and the bond that she thought she built with this person who completely betrayed her.
Mhm.
And our visit was more so a visit of reassurance and rebuilding her sense of worth and confidence.
Like you needed to reassure her.
I did. I needed to reassure her. I needed to rebuild her sense of self that she did not do anything wrong, that she was actually doing the right thing by coming into my office, first of all, to get tested.
What did she say that she felt she did wrong, that she should have known better, or
Somehow that she should have known, somehow that she just couldn't believe that this was happening to her at this point in her life, that she needs to be worried or nervous about contracting an STD. People think about STDs and we always think it's a young person's disease. And as such, because we always think that it's a young person's disease, we are like, oh, if it didn't happen to me in my 20s, I'm out of the woods kind of a thing. But even people in their 60s are getting STDs.
in their 60s?
Yes, in their 60s.
In like senior homes?
Yes, especially in senior homes. In senior homes, unfortunately, STDs are running rampant because of the fact that there's this notion somehow, I'm older, it can't happen to me. And so when you are a little bit older and you think you're in a trustworthy relationship, you can sometimes be a little bit more, I don't want to say lax, it's just that you're perhaps more confident in your relationship
And you want to believe.
and you really want to believe that all is well
And that this is the real deal.
and that this is the person, this is the future, this is your forever. And so it makes it really hard to conceptualize that you still have to do things like an STD check that seems so unnecessary. Let's just put it that way. Because if it's only you and it's only your partner, then
You shouldn't even be thinking about those
it's
things.
just
It's a thing of the past.
It's a thing of the past.
Yes.
Especially if it's not early into your relationship. Perhaps, I oftentimes would advise women early in their relationships, if they're going to start seeing someone seriously, or even if it's not serious, but they're definitely going to have an intimate or sexual relationship with them, that they get tested before. So that way they have that clean bill of health and can walk into a relationship, a sexual relationship, knowing exactly what their status was going into it and how best to protect themselves, which is of course using condoms. But this particular story, this particular patient just kind of brings back to mind that we always still have to be diligent. And understanding that sense of diligence just means regular testing.
Even if you're in a committed relationship.
Even if you're in a committed relationship. And when I say regular testing, you can figure out what the interval is for you. We typically say once a year.
Yeah.
But there are a lot of women who say, oh, no, I'll ask at every visit, would you like STI testing? Would you like STD testing today? And they're like, no, it's okay. Because they feel so confident in the fact that they are in a committed relationship that is monogamous.
Yes. And if anything, you saying that right now, it's almost like a stamp that says of course I don't need it because I'm in a committed relationship. You know what I mean? It's like that
Yeah,
is
I
like a
see it.
stamp
Yeah,
that
it's like,
says, no, I don't need it
how could I
because,
need it? Why would I need it? I'm in a committed
yeah, and
relationship.
it feels good to say
And
that,
it feels
or for the
good.
women who want this type of
Yes,
relationship. I'm
for
not saying
sure.
everybody does, but for those of us, or those of us women who do, that is almost like, I'm not going to say a seal of approval, but it just feels like that feels good to say it.
It feels good to be able to say, I don't feel like I need STD testing because I know I'm in a committed relationship. It gives you a sense of self-worth, self-confidence, but that is that self-worth and self-confidence should be there regardless of the type of relationship that you're in. And therefore, the routine checking of, let's say, STDs or doing it routinely is simply a part of your health. It's simply a part of your health care. It's simply a part of preventative medicine.
So it's almost like we want to disassociate those two things. It's just we should just look at it from a health perspective.
Yes.
Not like, oh, this means that I'm in a committed relationship.
Or
Like
I'm
almost,
not in a committed
or
relationship.
I'm not.
Right.
Yes. Like health is just health and
Yes.
that's it.
Yes.
Because that's the only thing when you think about it, that's the only thing we can control.
Yes. So the concept really needs to be that it's simply a part of my healthcare, my prevention, and it should not have a negative connotation to it, so to speak. I think many women feel like just by the ask that it somehow implies some negative aspect of it. It implies that they're not monogamous, committed, trustworthy, faithful, when that's not it at all. Of course, in this particular situation with this woman and this story, she asked for it, rightly so, because she realized that there was a potential that she was exposed.
But if I hear you correctly, what you're saying also is yes, that was the right and responsible thing for that woman to come and say, I want to get tested because she's taking responsibility of her body. But beyond that, that this is something that she could more routinely do regardless of the situation.
Yes. And I'm not saying that whether she did or she didn't do it routinely. It's more so the concept of let it be a part of your preventative care. Let it be a part of your annual testing when you go to your primary care doctor or when you go to your gynecologist, regardless of how old you are, unless your last time you were tested, you were negative and you've not had sex since then. Like, that's the only way that it makes sense to not get tested.
I would say also, and we touched a little bit on that, yes, there is this sort of not wanting to even think about the fact that, maybe there was somebody that was unfaithful, which is very hard to grasp when you're in a committed relationship. But the second part is when we do talk about from an STD perspective, it does have negative or taboo connotations. Like even in the 20s or 30s, because it's like,
you're
it's
promiscuous, you're
exactly.
dirty, you are sleeping around. And so, of course, we can think about all of the bad things that are associated with it. But major part of the problem as far as STDs are concerned is the fact that so many of them have no symptoms. It doesn't mean that you're promiscuous. And many women, a lot of women, are exposed to STDs or STIs at their first sexual encounter. So it's the first time that they've ever had sex. And yes, of course, this is partly why we always think of it as a young person's problem. But the reality is it's that it's an everybody problem because so many of these illnesses don't even have symptoms. So, for example, if we think about what's the number one STD, chlamydia, oftentimes women and men do not know that they have it. They do not know that they have it. And by the time that they figure out that they have it, oftentimes they may have had another partner, they may have been with someone else. And this is why things can spread.
So some people might say, well, if they didn't know that they had it, it means that there's really no symptoms. So why is this even an issue?
It's an issue because it can lead to other issues or problems. Infertility, it can lead to other infections that are more serious.
That would eventually come down the line?
Yes, so for women, for example, chlamydia can lead to an infection called pelvic inflammatory disease, which at its worst forms, the woman can then end up in the hospital and need IV antibiotics and can even end up with something called sepsis. So, which is a very severe infection that can affect all of your organs. So, yes, of course, there are a lot of STDs that have no symptoms at all or have varying degrees of symptoms. But at the end of the day, the number of times that a patient would have come in for a routine test, and then at that routine test is when they find out that they actually have an STD. And so it's not always that the patient walks in and says, oh, I feel uncomfortable. I feel something. I am having discharge. My discharge is yellow. It's heavy. It's smelly. And again, part of that problem is that is so nonspecific. So I guess the fact that they come in because they have some discomfort
Or something's different.
or just something's off, something's different, could lead to more questions and then lead to, well, let's just make sure and do some STI testing.
So I just want to go back to your patient that came to see you that we just talked about. And I think this is a very different way of looking at it in terms of just going and doing your routine checkup, like when we go get our pap smear, and at the same time we can do all our tests. Or you can also do that when you're doing your annual with your
Primary care.
with your primary care as well. So the only exception to that would be if you're not having sex at all. So maybe a way to look at it, unfortunately, because it deals with sex and there's stigma associated with it, we don't necessarily want to accept it as something that is that objective, maybe, but we need to sort of like change our mindset towards that. And one of the things I was thinking about, it's like if you have certain health issues with your cholesterol, but you say, well, I've been eating fabulous since the past year, but you're still going to get it tested, right?
Yeah, absolutely.
Because that's just part of the checkup.
It should just be part of the checkup at any time, at any phase, with whoever your provider is. It's just that I think for most people, they feel uncomfortable with even having the conversation.
It's reminding me of, how people are uncomfortable of signing a prenup.
I don't know how you got there, but okay.
No, because you want to be in a committed relationship. You have full faith in it. But at the same time, you're putting yourself protections.
Yes.
You're putting yourself a certain mechanism to protect yourself.
Yes.
And so even if it's uncomfortable, even if we never want to think about the fact that it might disintegrate, we still are saying, but how am I going to protect myself?
And the best way to protect yourself is to get tested.
Right.
That's just the best way to protect yourself outside of actually physically protecting yourself with condoms.
Yeah. So basically, I guess what we're saying that if you feel uncomfortable about that, if you are in a committed relationship and you say, well, I'll still get tested, we understand that that might feel uncomfortable, but it's still worth doing.
Yes, absolutely.
And so how did it go for that patient? Was she okay?
We reviewed her results a couple of days later, and through her blood tests, because she did not have any symptoms of anything. So through blood tests, she did have HSV, or what we call herpes.
Genital herpes.
And actually she had HSV type 1.
Okay.
HSV type 1 is what we usually associate with cold sores
On the lips.
On the lips. It's a form of herpes. It can present on the genitalia. And that herpes conversation is coming, everybody. Don't worry. We're not diving into it now. We will have this conversation later.
We promise.
But herpes type 1 can affect both the mouth or the genitals. And in this case, we did just a simple blood test because she had no symptoms, and her test was positive for the type 1 and was negative for type 2. Now, I like to explain to patients, if they get tested for herpes and it comes back as type 1, it's an incredibly common virus. And you can get it, type 1 is oral and can happen just from kissing. So this is not what I like to include per se as your typical STI or STD, such as chlamydia, such as gonorrhea, or such as herpes type 2, which predominantly affects the genital area. But it still brings about a sense of distraught. It still brings about a sense of, how could this happen to me?
How did I get it?
How did I get it? But when we think about herpes type 1 or oral herpes or oral HSV, type 1 HSV, I'm just using all of the terms here, cold sores. This is truly something that we're normally exposed to either as children, because we can get it from our parents, we can get it from other kids in our class, like in kindergarten, you're kissing your friends, and this is so insanely common. And I tried my best to reassure her, because I can't even tell her when she got it.
Or
She could have
from
had,
whom,
or
yeah.
from whom.
Right.
And the fact that she's never had a single symptom of it is typical.
So when you told her that, did that reassure her or confused her even more?
I think it made her feel, on the one hand, because I said, listen, you have the virus that can lead to cold sores in your blood. It doesn't mean that you've ever had a cold sore. It doesn't mean that you ever will have a cold sore. I can't say to you that you got this from this particular partner. You may have gotten it from 4 partners ago. You may have had it from when you were 5. I can't tell. And I think knowing that there was a possibility that she could have had it from way back, even as a kid, gave her a small sense of reassurance that it's not this lying, cheating dog of a person who gave her this thing, and that she was relieved that she didn't have anything else.
Right. More serious.
That's more serious. I do think that it gave her a sense of, I'm just always going to check myself out. Like
more regularly, no matter what.
Like no matter what. Like a sense of no matter what.
I'm not going through what I just went through.
I'm not going to go through what I just went through again, no matter what. The thing is that we're all human. We all want to feel that human connection. We all want to feel that sense of intimacy. And to have always lingering in the background, in the back of your mind, oh my God, I can catch something. Oh my God, I can catch something, is not healthy either. But
True.
I do think that having periodic, regular tests can at least give you a baseline and can certainly give you a sense of reassurance. And if anything does change, well, you have proof to say that it's changed. Like, hey, I got tested 6 months ago before I met you, buddy.
Right.
Now, all of a sudden, I've got chlamydia. And the only person that I know that I've been with is you. And so one of us is telling the truth, one of us is not.
Well, there's that part. And the other part is, again, just taking care of yourself to making sure that things don't aggravate, don't get worse in the progression of a certain
disease process. I mean, I think it's a sense of your own responsibility, your own taking care of yourself.
Is there something that we can do in terms of the stigma associated with what STDs are connected with, what we talked about, about sleeping around and all that, and there's this sort of default connotations associated with that? Like, is there anything that you've dealt with even with patients to reassure them that this is not about something that's taboo? It's just what happens with sex in this day and age, and
Well,
you
it's what
have certain.
happens with sex, not just in this day and age. It's been happening for since the beginning of time. This is not today only. I think there are certain things that are very prevalent, chlamydia being one, herpes being one, syphilis being one, in terms of prevalent diseases that are out
Gonorrhea.
there, gonorrhea. But A, I can't say this enough, always know your body, really have a good understanding of what's going on in your body, because you'll be the person who will come to your doctor and say, "Hey, I don't feel right. Something's going on. Can you please check?" Or know your instincts, trust your instincts. If you feel like something may be not right between you and your partner, or you're noticing some changes in the kind of level of intimacy that you have with your partner, or the relationship, well, that may be a trigger. And lastly, just taking care of yourself. It's just a part of taking care of yourself.
And when you said that you were trying to reassure her, were you able to achieve that with her? Like, did she feel a sense of peace eventually, would you say?
I think knowing that we are literally all in the same boat. At the end of the day, we only have control over ourselves. We only know what we are doing. We don't know with 100% certainty what our partners are doing,
Or anybody
or
else,
anybody else
that
for that
matter.
matter. And so I think it's important to have regular conversations with your partner or partners. For, this is not a judgment. The point of this conversation is not to cast any judgment. And I think in sharing that with her, that these things are extremely common, that this is not a reflection on her and her behaviors, but that, of course, her coming to be examined when she knew that there was something going on, and she doesn't know the information, and then it's like, oh, well, let me just get a new person, and then, just keep the thing going, you know, the possibility of risk. Instead, she took matters into her own hands, as we all should. And I think I was able to reassure her, and from that standpoint, that she's not alone, that she's able to trust her body and trust herself, and
And she doesn't need to feel shame.
that she really, and absolutely, she does not need to feel ashamed for something that she had no control over.
That is so important, because we just take that on and we don't have to.
And we don't have to. We don't have to. The most important thing she did that day was come in.
I would say also, it's easier said than done. I think that living in this society, and especially we're not even talking about religious influences and so forth, that sometimes some of us will not even realize that shame is so rampant inside of us.
Absolutely.
Because it's just omnipresent, it's just there. So I think part of this is to become aware of it and realize, okay, shame, we're going to put you in the box right here. Right now, I need to take care of myself, like just to be, but it's easier said than done, I know, but I think this is why it's good to have these conversations, to be able to say that we can like separate
we have
that.
to dissociate. We have to dissociate the taking care of oneself by getting checked or asking to be checked from the judgment or from the act itself. I think being able to separate, I am simply going to take charge, make sure that I'm okay before I further engage with anyone in a sexual way that is in the way that they feel comfortable. So I think as far as the STD conversation goes, we need to remember prevention is key. Those of us who are having sex, those of us who are thinking about babies, those of us who are in these committed relationships, right? You want to feel like you can be close with your partner and have those types of relationships. Getting an STD test, getting checked is simply part of prevention.
We just do it on a yearly basis. Just do it.
Just do it.
That's it.
Just do it. Just do it. And then obviously, if you do feel uncomfortable, you do have symptoms, you do have anything,
yes,
that you come in sooner, that you get tested, that you get checked. Then if you find out that you actually do have something, that you share it with your partner. Hey, I was just diagnosed with X, Y, and Z, and I'm letting you know because A, you need to get tested and treated, and let's have a bigger conversation on how did this happen.
So usually I feel like when we have a conversation, or I've heard conversation about STDs, people talk about the symptoms, people talk about the treatments, people talk about
that
prevention.
Will be in STD 101. When
Yes.
we can go into each and every one, we can go into the nitty gritties. Here, it was more so taking away the stigma of just getting tested. The shame that women can feel, or men. I'm not leaving the men out of this. It's just this particular conversation relates to a woman. It's more so the understanding that getting tested is just a part of taking care of yourself.
And the feelings surrounding this whole subject that one person can go through.
Definitely. That just the mere mention can trigger certain feelings and emotions, and that if we make it into a routine, then it doesn't have to do all of that. The other real point here is to understand that no one is above it. So it doesn't matter whether you're 60 or you're 20, we all still need to get tested as long as we're sexually active, because that's just a part of our preventative care. It's still just taking care of ourselves. It's still being honoring our own bodies, quite frankly, that we care about it. And so we check. And so if there's anything that may be awry, that we are able to then take care of it.
Awesome. So I think that the next time we'll dig more deeper in all different STDs and talk about them in more detail.
We will talk about them in more detail. This was not the podcast for that. Mm-hmm. This was remember that we still all need to be tested. There's no shame in it. And trust yourself, because you're the only one you can trust.
That's very true.
Oh, until next time. Thank you for joining us on the Dr. Sophia ObGyn Podcast. See you later.
Bye.
This is general medical information based on my professional opinion and experience. For specific medical advice, please refer to your physician. Until next time, embrace your body, embrace yourself.